I learned quite a bit in my decade as a mild-mannered health insurance executive. And we did good work, and we worked primarily to reduce the cost of care. But I think we were asking the wrong question. Instead of asking how do we reduce the cost of care, we probably should have been asking, for the $3 trillion we spend every year in this country, what do we get for it? What's the return on that investment? Or maybe even a better question would be, how do we invest in producing health? And if we asked that question, we would probably look at the data and the evidence and understand what matters to health most is this very large constellation of factors that are all interconnected. It's our context. It's where we live. It's where we work. It's the choices we make and the choices we have, and how all of those things come together to determine how healthy we are and how long we live. But instead, what we tend to focus on is a really vital component of this system that is mostly in the medical care system. And it turns out from the evidence, as David showed us, that that's about 10% of what determines our health over our life course. And yet, we spend about 97% of that $3 trillion every year in the medical care system. And just about 3% on population-based prevention strategies that could actually help us avoid the very illnesses that we're paying so dearly for down the road. And as a result of this, we have worse health outcomes than many other peer nations, and in fact, far worse in some cases. Well, what then really matters to health? What is this 90%? And when you try to peel it back, it's impossible. It's this intricate array of factors that are all interconnected. And it's hard to just tease one or two factors out and make a big difference on them because they all are interdependent. But we do know that education matters to health. In fact, those who graduate college live 5 years longer on average than those who don't graduate high school. We do know that social connections matter to health. In fact, your social capital or your social connections, your family and friends, are a bigger risk factor in premature death than smoking and obesity and lack of physical activity. And yet we don't tend to focus on those as ways to improve health. And we do know that investments in community-based prevention can make a big difference. So the Trust for America's Health did a study that showed a $10 per person per year investment in community-based prevention would return about a 5-to-1 return on investment in reducing chronic conditions. And if we were to look through the lens of an investor, we would say, well, what does the data tell us about what really matters to health? And how do we identify those improvement opportunities? And then how do we direct strategically investments into those improvement opportunities using evidence-based solutions in community settings and social settings, and in addition to the medical care system, reaching out to people in their homes and neighborhoods? And if we did that, could we then measure a financial return, and could we take some portion of that financial return and reinvest it in the system so that we've got this ongoing, perpetual health machine? If we can demonstrate that we've reduced the state's Medi-Cal budget and we can create performance contracts between the investor and the state, then we will have a repayment stream back to those investors. The state will retain the majority of those savings, and a portion of those savings would be put back into the community to expand the program. And the question we're asking is, can we take that same health impact investing model and can we expand it at a community level? And so earlier this year, we launched a call for applications to launch what has become a 5-community, 5-year health challenge to create these investable markets for health. We got 42 communities to apply from across the United States. And from those, we selected 5 communities to work with, and this greater Wellville network of 40-some-odd communities that will learn with us along these 5 years. And an ingredient for a successful investment, strong leadership team, an idea that's pointing to a new untapped or potentially expandable market. So we're applying this discipline of the investor and startups to the community. But in this case, the community is the startup and the product that they're delivering is health. So how do you do that? This is a little bit of a complex diagram, but we think the way to do this is there are three components that we need to create within these communities. The first is this mechanism for capturing a portion of savings or value that's created through the production of health in these communities and creating this repayment or reinvestment back into the community. The second is that we need a portfolio of investable solutions. What does the evidence tell us that if we were to invest in it, like childhood asthma, it would return not only better health outcomes, but also potentially financial outcomes to our investors. And then finally, we need, and I'm going to borrow from David's world here, a capital stacks approach to financing community health. And I just want to blow up that last piece a little bit. So we think that this is not going to completely be investor-driven. There is a baseline investment that philanthropies and public funding, community development is making in these communities. But we think that what we can do is build onto that with impact investors that would be interested in programs like we've launched in Fresno, but now looking at other opportunities, diabetes, reductions in homelessness, improvements in pre-K, reducing the rates of recidivism in communities. All of these larger factors that will ultimately create healthier communities. A really important partner for us in each of these 5 communities are the local health systems. And all of these communities were selected in part because they're health systems that are somewhere on this journey from volume to value. And they understand that generating revenue based on population health outcomes is where they need to go. And we want to be supportive in helping them along that journey.